The Omicron tidal wave is coming, according to the Prime Minister, with cases of the variant nearly doubling over the weekend and huge pressures expected on the NHS in the coming weeks.
So, do we need more restrictions and even consider another Christmas in lockdown to save lives? Professor Stephen Reicher from the University of St Andrews wants people to seriously consider, I suppose reconsider might be the word, their social activities this Christmas. And we also have political commentator Dominique Samuels, who worries about the impact of further restrictions on people's mental health. And we have just done the Million Minutes campaign, Dominique, and I suppose that in itself goes to the heart of what you particularly are worried about. Let's talk to Professor Stephen Reicher to set it up first, though, because, of course, at the moment, people are working from home. You both are this morning, as we can see. But you can meet in the pub. Christmas essentially is still on. Some Christmas parties, though, Professor, have been cancelled. The ITV one here has been cancelled. I know lots of others have been too. What aren't we doing enough of in order to save the NHS?
So let me start off by saying I think there's a real danger of setting up these debates as a Punch and Judy show, as if we are just having a go at each other. I absolutely agree with Dominique that mental health is an extremely important thing. I would, as a psychologist, I've written at length about the importance of social connections and the dangers of loneliness. But the problem is, and we've seen this throughout the pandemic, and the evidence at a global level supports this, if you don't do enough to contain the virus, then what happens is things last longer, get more serious, and you have more harm done to public health, more harm done to the economy, and indeed more harm done to civil liberties. Now, at the moment, we're in a situation where the new variant, in effect, is coming at us like an express train. It doubles every 2 or 3 days, doubles 3 times a week. In 1 week, you have 8 times as much virus, 2 weeks, 64 times as much, 3 weeks, 512 times as much. And even if it is, and I hope it is, less virulent in the sense of leading to less hospitalizations, even if it leads to half the hospitalizations, in a week you're going to have 4 times as many hospitalizations. So we've got to do something, or else we're in real danger of overwhelming our society and overwhelming the NHS. And there are so many things you can do. The first thing, and the most obvious thing, is that if you reduce the number of social contacts you have, you limit the spread of the infection. Now, nobody wants to give up their Christmas parties, and nobody wants to miss out on meeting up with people. But it's a little bit like Christmas dinner. The danger is that if you have too big a Christmas breakfast, then you spoil your appetite for your Christmas dinner, which is what really counts. And I think in the same way, we need to think really seriously about our contacts. How important are they? Do we really need them? And is it more important to act carefully now so that the contacts we really want and we really need are still happening? And the other thing is, and if I can make one final point, one of the problems in the past of so-called lockdown is that lockdown, I mean, all the evidence suggests it does bring infections down, but if you don't change anything during lockdown, they simply go up again at the end. So the question of restrictions is, what are you going to do during that time to make things better so we can lift restrictions? And there, we've got to get more people vaccinated, and we've got to make sure that our environments are safer, better ventilated, decent ventilation in every school classroom. And if we do that, if we use the time wisely, we'll be in a better position in the new year.
Sounds all very reasonable, Dominique, does it not?
Well, I'm not so sure. I know that people will probably look at me and see a 23-year-old. However, in terms of the evidence, when we're talking about Omicron, Dr. Angelique Coetzee from the South African Medical Association, she's been observing Omicron for 4 weeks now. And she said it's, majority of the time, it's mild disease. And she said this is true whether you're vaccinated or not, whether you're a child or an adult, or whether you have other comorbidities. And Omicron has been the dominant variant in South Africa for at least 1 month, and their deaths are at their lowest levels since the start of the pandemic. Hospitalizations are growing in the epicenter where the first outbreak occurred, but out of 42 patients, 37 of them are in hospital for non-COVID related diseases. And this is the same thing that's been said in Europe as well. The European Centre for Disease Prevention and Control said as of the 12th of December, known Omicron cases are asymptomatic or mild, and there have been no deaths reported so far. And when we talk about the NHS, I do really struggle with this idea of it being overwhelmed. When you actually look at the facts and figures, you don't need to be an epidemiologist to actually look at them. COVID patients are 55% lower than last year. There are 80% less deaths compared to last year. And COVID patients only account for 5% of general and acute beds. There have been a lot of people that are saying that, you know, in critical care, it's full of unvaccinated people. Well, the latest actual research we have shows that in October and November, only 48% of critical care patients were unvaccinated. So I dispute the idea that, you know, it's going to be overwhelmed. But I think what we should be talking about is healthcare reform. The total number of NHS beds in England has more than halved over the past.
But that's not going to change before. I appreciate the wider point, Dominic. Absolutely.
It's not...
Go on.
Can I just finish this last point?
Can.
Okay. And during this pandemic, hospital beds have actually gone down instead of up.
And I completely appreciate that point. And I'm sure, Professor Stephen Reicher, you understand that, of course, if we had more beds, our rates of hospitalisations, you know, per intensive care unit would be less for COVID, right? Because there's just more beds available. That isn't going to change between now and Christmas. So I suppose the question really is, can you understand from Dominique's point of view that there is a lot of stats out there, and she's listed a many great number of them, that actually show, from her point of view, that Omicron, that there is potentially, in many people's view, an overreaction?
Yes. Well, I very much hope that Dominic is right. And I hope it turns out that Omicron is less serious. And there's even a best case scenario where Omicron actually outcompetes Delta and is less serious, and therefore in the long run might even be a good thing. But in the short term, that's not the position. So first of all...
we have... You've spoken longer than me. We have evidence from 4 weeks in South Africa. The chair of the South African Medical Association has said verbatim, you need to trust us because we've dealt with this. We know the reality. There is not mass hospitalizations. That's not what happened. It's been in South Africa for about a month. It was also in Europe, in the Netherlands, 11 days.
Let the professor reply.
Okay. So what everybody agrees on is there is uncertainty about how serious it is because it's too early to tell. There is a lag between infections and cases and deaths. What we're seeing is that cases have gone up very quickly. Now we're beginning to see that hospitalizations are going up in South Africa. They went up 81% last week alone. And as for deaths, well, it's early for deaths, but actually, because a lot of the cases haven't been sequenced, it's hard to tell what people died from. And in fact, the excess deaths in South Africa doubled last week as well. But the point is, we are uncertain, and I think we can agree we're uncertain.
And just to clarify,
the question is, if I could just finish, please. Yeah. The question is, what do you do in conditions of uncertainty? What are the risks? Okay. Well, the risk of getting it wrong, of allowing cases to spread and it to be serious, is that we would see the NHS overwhelmed. We could see up to 75,000 deaths. The cost of taking... But we're going to stop both of you there because I want to clarify. We did speak to the person. We don't die.
OK, Professor Reicher, I just want to stop you there. I just want to clarify something because Sean actually did speak to the chair of the South African Medical Association earlier on this morning, and she did say that there are hospitalisations, and at the moment it's unclear. They're still doing tests. It is unclear whether their primary reason they're there is for another condition or because of the Omicron variant. That's what she's saying at the moment, isn't it? So it's still that bit is unclear. So we need to. Angela, we spoke to Angelique this morning, Dominic.
In situations of uncertainty.
And one more thing. I'm not saying you're wrong about Angelique, but what I'm saying to you is when there is uncertainty, as you're saying, despite the fact that both in Europe and South Africa, where it came from, they're saying it's mild, the solution to that is not locking people down. And
they're certainly not saying it's mild.
There are people that won't survive another lockdown, and I think it's really irresponsible to be pushing for it, especially when in places like Scotland, in places like Wales, where they had things like vaccine passports, where they advised working from home and had mandated masks, throughout a lot of the time they've actually had higher case rates than England despite all those measures. So there is no evidence that restrictions like those actually...
That's interesting, Dominic. I mean, there's no rushing towards it. Even Plan B doesn't include social distancing, which I'm sure the Professor would wish it was in there. Just a final word to the Professor, if we can. At that point, we've obviously seen those scandals around the parties and breaking, potentially, of lockdown rules by Number 10 themselves, by the Prime Minister themselves, allegedly. That will all be investigated. The point that Dominique's making there is, even if we wanted to bring this in, whatever those extra restrictions were, as a psychologist, you've written about these things, in a word, do you think the public would adhere to them? Given what the scandal has been recently?
The evidence shows that many, if not most people, have been adhering despite the government. Many of the people who were most angry at Cummings adhered more because they wanted to show they're not like that they do care and they look after each other. And I think, as Chris Whitty said and as Sage said, if you explain clearly why things are necessary and why it's important to limit our interactions, people will do it as they've been doing it throughout the pandemic.
Okay.
The lesson of this pandemic isn't that we've had a government that can't take measures because the public won't wear it. It's a public that understands what needs to be done and hasn't always been given the support it needs.
OK, both. We'll have to leave it there, but thank you, Professor Stephen Reicher from University of St Andrews and political commentator Dominic Samuels. Thank you both for joining us this morning.